meeting of the Communication and Stakeholder Engagement Committee. Today, we're going to talk about something that's on everybody's mind, the coronavirus. And yes, we've been talking a lot about it, but we think that there's still a lot of misinformation out there and that the community has a lot of questions, and we hope we'll answer some additional questions today. So I'm going to turn it over to Derek. Thank you.
Let's go around and have our...
Sorry, forgot. Introduction. I'm Brenda Wolf, the Vice President of the Board and Chair of the Communication and Stakeholder Engagement Committee.
Good morning, Rebecca Spondrowski, District 2.
Good morning, I'm Carla Silvestre, School Board Member at Large.
Go around the table.
Good morning, Sabrina Hernandez, the Recorder for the Board of Education.
Sherwin Collette, Associate Superintendent, Office of Employee Engagement and Labor Relations.
Krishna Tulur, Director, Employee and Retiree Service Center.
Good morning, Ed Clark, Chief Safety Officer.
Good morning, Doug Hollis, Executive Director in Operations.
Good morning, Derek Turner, Chief Communications Officer.
Good morning, Meredith Williams, Communications Specialist.
Boyende Onijala, Supervisor and Spokeswoman for the district.
Good morning, Siobhan Alexander, Director in the Office of Curriculum and Instructional Programs.
Good morning, Maria Navarro, Chief Academic Officer.
Good morning, Rochelle Rubin, Associate Superintendent in the Office of Student and Family Support and Engagement.
Good morning, Aranza Labat, Executive Director, Office of School Support and Improvement.
Good morning, Lori Christina Webb, Chief of Staff for the Board.
Well, you can see this is an important topic. We have brought out everybody. So I'm going to turn it over to Mr. Turner now. Oh, well, no, wait, one more thing. We have an informational summary. I know you didn't get it early, so what I'm going to suggest is if you have any changes that you send them directly to Sabrina. Okay, thanks.
And good morning. So thank you, Ms. Wolf and board members. Before we discuss the crisis at hand, I want to take a moment to talk about crisis response and communications more generally. Crises can be large or small. They can drag out over months or years or be done in just a few minutes. A crisis can stem from external factors like the crisis we're talking about today, or it can stem from an internal decision. But crisis, especially in a large school system, at its core is inevitable. How we respond to a crisis is what really makes the difference for a school system. Each decision that we make in these high-pressure situations has consequences, both intended and unintended. And how we communicate these decisions can either ease the tension or create additional panic and anger. Today we're going to talk about a worldwide crisis, COVID-19 or coronavirus, and how we are responding to it locally in MCPS. You're going to hear from MCPS team members who are managing the day-to-day, hour-by-hour, and in fact minute-by-minute changes in this issue and helping the community understand how we were preparing for this response and how we're managing this crisis. But before I hand it off to my colleagues, I just want to play a little game of myth-busting if folks will indulge me. So myth number one, MCPS is closed today. In fact, we are open. We are seeing our creative community create pretty good fake media posts that look like news stories that suggest that our school system is closed, minus some serious typo issues in those posts. We know that our community members start to believe them.
I have a question. I was looking on Howard County's website this morning, and I noticed that they post every day whether they're open or closed. Do we have something like that so people have a source they can go to actually know, yes, we are still open?
So we've had a long-standing policy. So if there's rumors out there that we might be closed, we've posted something those days. But the de facto is if you don't see anything on the website, we are open. You should expect to come to school.
We should post that on our website.
I think maybe for the time being, we should actually post on our website, we are open today. I mean, I found that helpful. I don't know if anybody else would agree, but I found it helpful.
So we can definitely add that to our website. The other thing we're hearing is that Fox News personality Laura Ingraham shared on her show yesterday that her kid's school in Montgomery County, Maryland is closed for the rest of the week. The best we can discern from this is that her child goes to a private school. and that she wasn't intentionally trying to mislead our community. But again, we are open, as far as I can tell. All of our kids are in school. But again, this is a day-to-day conversation, and things may change as the situation evolves. Myth number 2.
Can we add all of our schools? Or
Yes. Myth number 2, MCPS makes decisions about closure for coronavirus. We've seen a lot of emails to Superintendent Smith demanding that he close schools immediately.
There's a petition.
Yes, 7,000 folks have signed on board. I'm not sure how many of those are local versus those folks who just like to add on. But the fact is, the Department of Health and Human Services actually makes the call about closures when there's a public health emergency. That is no longer our role. We can still make closures around operations, but it's their decision around public health emergencies. Next question. Dozens of students have tested positive for COVID-19. Again, some good mock media stories. However, they are false. The information about the number of cases comes directly from the state health officials. Those are the cases and those are the real numbers that you see. We follow that information and don't know any information beyond that. And then my favorite is that everyone in Montgomery County, as our streets are paved with gold, has access to device and the internet. It's just not true. Our community, while we do have great adoption of internet, we don't have universal adoption, and that's really where a question of equity and inequity comes, and we'll talk about that more with instruction. We did a survey last year where we got 58,000 student respondents, and roughly 10% of our students don't have access to a device, and roughly 7% don't have access to the internet. And I just want to give a caveat that when we say device, it could be a cell phone, and we don't usually assume cell phone is how our students are going to be able to access their work.
Can you repeat that? I was going to say they might, though.
So of the 58,000
So of roughly 58,000, 10% they said they don't have access to a device that could access things online, and roughly 6% said that they don't have any internet access at all. But with the caveat that if you have some kids are responding, I have a smartphone, but
right.
as we think about what's the best learning device, is the smartphone the right tool?
Derek, and I just want to point out that what we know about surveys is that sometimes people underreport. So we always take that with a caveat that, again, we have 58,000 respondents. We have about 11,500 students per grade level. So we had a sample population, and in those kinds of questions, we may also actually be seeing an underreporting because people may not necessarily want to just let you know that that's the case. So some people might be like, well, that's a really low number. We take that with a grain of salt.
Yep, exactly. And I hope that that kind of accentuates why it might be important to be communicating through text message for a lot of our families, just because even when they don't have, even if they do have access to the internet, a lot of people work in types of jobs where they can't check their emails regularly throughout the day. So,
And we don't have any other estimates by the county or the American Community Survey in terms of internet penetration in the county?
I believe there is, from a few years ago, some data, but I don't have that with me, but I'm happy to share that once we can gather that for you.
Okay, thank you.
So you are going to be talking about how we can ensure access for all of our students.
That's exactly right. So I just wanted to give a framework of some of the things we're hearing. And now I'm going to turn it over to my colleagues Doug Hollis and Rochelle Rubin to talk about the work that we're doing, which actually leads to the communication on the back end. So.
Good morning again. This morning we just wanted to start with a larger overview and then dive a little bit into some specific things that we are doing and how it pertains to communication and how we engage our stakeholders. The big thing that I begin with is our efforts here are not in isolation. We understand that we, as a school system, impact a great part of our community. But in the midst of that, we have been working for the last couple of weeks with county officials. In the late January, our county kind of stood up their planning team around this. Shortly thereafter, a few weeks after, we started looking at our own operational plans, particularly for emergency situations, and began to say, what if things happen? What if things unfolded in a quicker, evolving way? With that being said, I think last Thursday, and even right before last Thursday's announcement by our governor, it put us in a different position. It took us from a group that was working in small work groups to a team that we are clearly now in an incident command structure, a structure that has us meeting daily, but a structure that also has us communicating with state officials daily. We participate with state and county officials daily to hear what's going on, and more importantly than anything, really to hear from DHSS around what is the latest update, what is the latest guidance, because as we know in COMAR, they actually have the power and authority to speak towards if our schools need to close. They also have the information about any specific case that impacts a school.
Okay. Just a question, can you tell us who's on this team?
Yeah. So there are a number of people, and I think it's probably easier if we followed up, but I'll give you how we've covered it.
Okay.
So Dr. Navarro and Dr. Zuckerman actually have guided the leadership of myself and Rochelle Rubin are leading and co-leading together. Dr. Zuckerman and Dr. Navarro both being on the cabinet just gives them a quick way to liaise with that group in a way and helps in our coordination there.
Let me just rephrase that. Can you tell us who is not in MCPS who might be on this team? Because I'm assuming that all of you here are all associated in some sort of way. So are there county health people? Is the county executive's office involved? Is the county? I want to know.
That's great. I follow you.
Okay.
So I think the best way to answer is there's no one from the outside that sits in on our incident command daily.
Okay.
But on a daily basis, we participate in a call that is stood up by the county, by the Office of Emergency Management, as well as Department of Human Services. Additionally, they have been very gracious to us. I think it makes sense, but we'll state that they have been gracious in allowing us to have direct conversations with them. I would say on a daily basis, there are a number of text messages, calls, additional email questions that go directly to Mr. Travis Gales, who has been an individual who has shared publicly to our community, but also is giving us direct guidance that speaks to our coordination there. Also, Dr. Earl Stoddard, who is over the Office of Emergency Management, has been another individual that we have reached out to on a daily basis.
Okay, thank you.
I think when we think about this work in the continuity of schools, we think of it in an umbrella in many ways. I think the big pieces are, how does instruction continue now, and if something worse were to happen? How do operations continue now, and if something worse were to happen? And then how do we care for our people? And that's student, staff, as well as our community members that come in and out of our schools on a daily basis. So that is the frame in many ways of how we think about the continuity of schools. The big lever there is communication. And as we think about the work that we've done and how we work together, I think what we often lift up is communication, prevention, and education. And so I now would turn it over to Ms. Rubens to talk a little bit about some of the educational stuff around coronavirus, and then we'll delve into the specific pillars of how we are taking care of our students, our staff, and that continuity of instruction.
So thank you. Good morning once again. So we thought it was really important and integral that we started, as we take a look at this from a student services perspective. We're in a unique position in MCPS because a lot of this is preparatory work that we're engaged in. So it gives us an opportunity to really plan, prepare, especially how we're going to direct our services, because our schools, they serve a multitude of functions in the community, not just the academic piece, but certainly we're concerned about our families who may be facing food insecurity, shelter insecurity, and all of those components we're factoring in. So this gives us an opportunity to think about that We also wanted to just start off by talking a little bit about the science. The educational part of this work has been us reaching out constantly in a multitude of ways to the community to really provide the prevention measures that we're hoping is having an impact in helping to stem the tide of the virus potentially spreading in Montgomery County Public Schools. A few of those measures that we've put out to the community, of course, avoid close contact with people who are sick if at all possible, avoid touching your eyes, nose, and mouth. I'm struggling with, I did not realize how much I touch my face during the course of a day. Right? Certainly, we're promoting stay at home if you're sick. Those absences are excused, and we're going to have more communication coming in reference to that. Cover your cough or sneeze with a tissue, then throw that tissue in the trash, certainly. Cleaning and disinfecting frequently touched objects. You'll hear a little bit more about how we're going deeply into that cleaning for our schools. And then certainly the washing of hands we've been promoting, especially during that lunch period, gives our schools an opportunity to really push our students around that. So this is how we're hoping to prevent the spread and some of the educational pieces that we're doing in the community. To further that goal, I'm going to transfer to Siobhan Alexander, who's going to really give you the detail about how we're engaging in the thoughtful work about the continuation of learning should a worst case scenario of us having to close schools occur.
Thank you. Good morning again. In preparation for a school closure, a cross-office group from the Office of Curriculum and Instructional Programs, the Office of the Chief Technology Officer, and the Office of Special Education was charged with developing a short-term learning plan for students in all grade levels, as well as charged with collaborating with union partners to develop a long-term learning plan in the event we are closed for multiple weeks. The short-term learning plan ensures that instructional activities are available for students immediately and for a short period of time. The intent is not that they would provide new instruction, but instead that it would be an opportunity for students to practice, review, and extend their prior learning. The instructional activities focus on core content areas with some opportunity for extension into other areas.
Question.
Yeah.
You said short instructional period. What's that? What's that look like?
So we're going to talk a little bit more about that later. Okay. The charge was to have something that students could tomorrow have available. Okay. So as we start to talk through the short and the long term, we're going to look at what makes the most sense for how long it could last. Yeah. The instructional activities will be available in a MyMCPS online course through our learning management system Canvas, as well as available in hard copy for students. And so currently the work being done is to make sure everything's loaded online, as well as our copy machines are going crazy to get all of those materials ready. Yesterday, our team met with representatives from all three unions to share the short-term learning activities and begin to think about the long-term plan. The reaction from our union partners about the short-term plan was that they really liked it. They thought it provides some district-wide consistency. It gave students options in terms of what work to do and how to do it. It aligned to the curriculum. It was grade level and or course specific, and it was of high quality. So we were really happy with their reaction, and so have that plan really well finalized. This week, we will continue to meet with our partners later in the week to start to talk more through the long-term plan that will support student learning, and also the issues around how to make sure it is equitable and accessible to all students. We envision that a long-term plan may appropriately look different for elementary age students as compared to secondary students.
What do you consider long-term?
So we have been continuing to think through what that looks like. In terms of the resources that the team that made a short-term plan did, we produced about 3 weeks worth of activities for the short term. To be clear, we're not saying that's how long the plan would last, but we wanted to be proactive knowing we would have one shot to kind of put things in kids' hands. So we wanted to be able to be agile if we wanted to move to a long-term plan sooner, but have a good amount of materials that would be delivered in that first shot. So that's our initial work around short-term and long-term. Unless there's questions, I can go ahead and hand it over to Mr. Hollis, who will talk more about the continuity of services from the operations side.
Just something to add.
Yeah.
Something to add there that we shared recently with the community in our message that went out just a few, what's today? Yeah, Monday. We wanted to make it very clear that these resources that Siobhan just spoke about would be provided only in the event of a closure. What we're hearing now and what we're trying to address through some of our communications are direct asks that we provide all of these materials now, even though schools have not closed. However, per the guidance from DHHS, it's business as usual, instruction as usual. So it's an issue of equity. If some families decide to pull their children out now because they're concerned maybe these children are sick, that's certainly understandable. But if we provide those online learning resources now, but everyone else has to come to school to receive instruction, we're dealing with issues of equity there. So we just want to make it very clear to our community that at this time, these resources that Siobhan just described will not be made available until there is a school closure.
So if there's a school closure, how will the kids get the resources?
So that's part of what we're talking about, that we'd have to look at distribution methods, how we would get those hard copies out. Certainly that's information that could be quickly placed up on our website, but there are a number of methods and ways we can look at getting those hard copies to those families should the announcement come. And our hope is that, we'd have enough lead time from the Department of Health and Human Services. So it's not like, okay, we're already in school and we're shutting you down now, but working with them, being able to get those materials, they're ready, they would be ready to go. So if we have that advance notice, we'd quickly be able to get those packets out to families and get those websites up.
Right. My concern is that we wouldn't have that lead time. Like I know University of Maryland shut down last evening. So kids who are already gone won't necessarily be going back, especially, I don't know if the campus goes into lockdown or who makes the decisions for universities versus public schools. But that I would be interested in, if you know.
So if we had an emergency where we wouldn't have any lag time and students were sent home and didn't come back, we would devise a plan to figure out how to get the resources to students. I think our main point here is that we want to have an option that if you don't have a digital device or you don't have internet access at home, we will get you paper resources to do that work. And I think that's fundamental in some of the questions around how we target this equity issue and access issue for families.
Yep.
We would have to devise, obviously, a plan for that, and I think we're talking through what that would look like. But for the short term, and I just want to be very clear, for that short term, having these district-wide learning plans, extension plans available does allow us for students to be home with, again, curriculum-aligned district materials that they can do as enhancements of their current learning.
Hey, I have a question, just because I don't understand exactly how this is going to work. But if you say short term is about 3 weeks, let's say that, isn't that a lot of instruction to lose? I can understand you saying some of the kindergarten kids might be just doing reinforcements or enhancements, but isn't that quite a period of time? And would you be looking for the same thing at the high school level, let's say?
So I just want to clarify that although Siobhan mentioned that we have 3 weeks worth of planned activities, we are thinking short term to actually not necessarily be 3 weeks. That's an extended period of time. We're looking at somewhere between about 5 days to a couple more days out of school. And that right now, in the follow-up meeting that we're actually having tomorrow to continue this conversation with our partners, and I just want to point out, yesterday I got a chance, I left the board meeting and I got a chance to pop in to see our teachers and our paraeducators and our principals all convene in the cafeteria. And their number one issue is, They're worried about making sure that their kids are still having opportunities to read at home, to continue to do their math problems at home. And, I just want to publicly thank our teachers. They are incredible, and our principals and our paraeducators, because that was their number one concern. How do we work together with you to figure out ways in which our kids are, if they're doing multiplications, then they can be working on fluency at home, and what do we give them, and how easy can they get it, and can all my kids in my classroom get it, because, Maria is Monday through Thursday with her dad, and then, lots of really detailed. So we are excited about the fact that we're working collaboratively. We have another meeting tomorrow night to think about the long-term plan. We needed to buy ourselves time for the immediate. And that immediate is a district plan that gives right off every kid access to good aligned instructional materials. And then we'll continue to flesh out the longer term, like you mentioned, 2-3 weeks off.
But
okay,
well, just
potentially.
following up, because I was thinking about that this morning, is we've got graduations coming up, and so what happens if we're not open come graduation, beginning of graduation times?
She doesn't want to hear that.
I know, sorry. But then, and B, what about kids who are struggling to make sure they've got the credits they need to graduate if they're out? How's that going to potentially affect them?
And so those are all work that the instructional plan functional team is talking through, knowing that there's lots of what ifs, right? The state may change things, they may not. We're trying to keep the people who are coming up with kind of the work aside from getting sidetracked by it, but in the background be thinking about different possibilities and what solutions for them would be. And so we've had lots of different, you mentioned some of them. We know there's resources every day that are popping up as well. For instance, our partners with AP and IB have provided some resources that are part of the online resources that are available to students in the short-term plan. So we're trying to be agile while still thinking of those long-term pieces.
And I think it's just worth noting that if Montgomery County closes its schools, it's not as if we're going to be the only ones who close our schools. It's going to affect the whole state. So some of these decisions actually are statewide decisions.
Right.
Fully recognizing that, I still think, there's a lot of parents who are concerned about.
So while you're thinking about the potential for long-term planning, I hope you're thinking about if we can't help the child with the homework, how do they get help?
Absolutely. And so we're trying to employ both high-tech, low-tech print options. We've talked about broadcasting on, MCPS TV, that's on cable television, but also having YouTube video versions of it for people who may have access to provide those short segments. And that was really why we thought the short-term content had to be something that was review.
Okay.
So it didn't require a lot of help. Parents, of course, are always welcome to support their child, but the intent is not that it would require an adult sitting with the child.
Thank you. Go on.
I'm going to take a moment to speak a little bit around operations. There's a great amount of work in operations. I'll cover facilities, transportation, food, and then I want to turn to my colleagues here who will speak a little bit around safety and just the overall work around safety, and particularly how it relates to our emergency response, as well as employee services and our work with our associations. In terms of just operations, for facilities, we've given some guidance to principals, and principals have begun to also then share information with teachers. There's a couple of big things here. We're still in the state where we're preventative. Because we are still in normal operations, our focus is how do you continue to prevent, what are best practices. And so some of the educational material that Rochelle showed in the beginning is continued to be shown around the building, because one of the things we want to say is there are additional things that teams are doing because they are responsible for that work, but there is also a partnership, sort of like we speak of safety, where everyone needs to play a part. And so the key points here are there is a building schedule for cleaning already in place. First thing for all principals, and principals heard this message last week, and they have been emphasizing it, working with their building service managers, about review the plan, and let's make sure that plan is happening. And if there are any barriers to that plan, let us figure out how we enhance or support you in making sure that plan happens. So that's the first part of the plan in terms of cleaning the building.
One question, and you may already have an answer for this, I don't know. But I was reading that, children that are asthmatic, you can't just clean a building with anything. So it looks like a lot of the stuff that they want you to clean with might be a problem for some children. What are we doing to address that?
So I just want to, there are two different things that happen. Products that we currently use in our building are safe for everyone, and that's the only thing that we use. The concern about people who have pre-existing health concerns relate to if the building had a confirmed case in it and we had to do something different in that building, in which we make sure that we have provided enough time for, one, those workers to be safe while using additional chemicals, and two, enough time to pass before anyone has to enter that building again. Okay? Yeah, I'm not sure that we put out on the sheet, but we also, part of the plan, and I think Ed could speak more to it, is making sure that it has returned to regular levels in the building, and we do testing for that after that cleaning is done. Yeah. And so that's the facilities part of it. The other part around facilities is our building and area managers who work out of central services are now convening on buildings and spending all their times there to make sure that there is support where needed. We are using all the TPT workers that we have. There are a few schools that have mentioned they had a person who was out on their staff. So we want to make sure that they have a full complement of staffing to make sure those things are happening. One thing that community members may see is there are a lot of individuals who work out of central services who are now on buildings, walking in buildings, and they are actually walking around with squirt bottles and towels in their hand. One of the key focuses for us is how do I regularly clean and more frequently clean high-touch areas. So door handles, handrails, etc. Those are places where we are making sure we do that. Internally in schools, we're also sharing good practices that are already in place. I think we have heard from a few physical education teachers as well as art teachers who, after every period, are already using wipes and wiping down all the things in their classrooms. So now we're looking at some of our regular classes and having that sharing among the school and saying, what are the additional pieces there? As I mentioned wipes, let's just speak to supplies. And so as we think about supplies, Jeannie Dawson and her team are working to just procure more and more things. There are some outrageous numbers in terms of the ordering that we have done over the last 3 weeks. And the good thing is there are some folks in public, and most of us here, if you try to go on Amazon, even some businesses, and try to order something, it's out of stock, right? Either there's price gouging or it is out of stock or unavailable. All our orders have been processed. Many of our orders will continue to be processed. The challenge with everyone right now is delivery times. We are currently on phones daily, making sure that those hand sanitizers, those wipes are coming. The procurement official that works for the county has some connection with a few of the vendors who have the things that we need, and he's doing some additional calling on our behalf. And that's something that has been discussed on the county calls, which really speaks to the point of us sitting at that table and being a part of a larger county and larger community effort. The other piece I think we could speak of is just food. Currently, we are looking at some of our practices in food. That team has been trained. That team has reviewed their standard operating procedures. They are enhancing and making sure that everything that we prepare and serve is done in a way that is in accordance with Department of Health, but also just national guidelines around a crisis such as this. That said, we talk about continuity of operations in the current as well as the worst case. And so one of the things we have begun to explore is what are the ways that we possibly would be able to deliver meals to students if we were closed for some period of time. And so if this turns into where our county officials are concerned about the communal aspect of the virus, then we wouldn't be able to do traditional standard plan of we stand up a few sites and have everyone come into a cafeteria like we do during a snowstorm. But what we could do, and these are the things that we are discussing with them now, is are there possibilities to do a grab and go? People could actually come to your site at the front door, grab what they needed, already prepared for them, so we weren't necessarily promoting the congregation of a lot of people. The other piece that people have suggested is that part exactly. Can I get food to communities? We have a large fleet of buses. I think we all are aware of that. Can we do that? But then how do we also partner with public safety officials to help us make sure that there's not a lot of congregating, there's no issues in dispersing crowds if by chance our efforts are to then bring food to community, but not in the same time cause a larger communal outbreak.
I was a little concerned about our own employees being the ones doing that, and how are we going to be able to protect them if they're involved in this kind of distribution effort?
Yeah, I think there are some standards that we will be following. CDC as well as our county are looking at what are the additional measures that we take for frontline staff who are interacting with communities in this way. Additionally, there's an additional level if there is a confirmed case and there's a possibility of you interacting with a confirmed environment or something of that nature. At the end of the day, the safety of our staff as well as our families is first, and so we have to just think through and work through how we do this. And so I do think there may be some challenges there, but I do think there are some avenues that we can explore.
I have a question. So kind of, I'm not sure this really is your purview, but I'm going to ask anyways. Two things. Number one, the confirmed cases that have been identified in Montgomery County, where are those people? What are they doing? And the second question, not to sound insensitive, but why is this such a, I mean, if looking at your first slide, there are a lot more contagious things out there. The flu kills a lot of people every year. Why is this such a, is it just because there's not a vaccine or a cure?
So we can start with the latter first, which is it's the lack of information and knowledge. And to be honest, part of our work in engaging our community, but also being a part of larger task force that are looking at this, is so much changes daily. And currently, it looks like there are some clear indications as to everyone in this county who has contracted it. I think people understand why. There's nothing that has public health officials saying, I'm greatly concerned, therefore go into these drastic kind of measures such as close schools or otherwise. But I do feel like as things begin to pop up in neighboring counties, in neighboring jurisdictions, there are pieces where people are trying to just better understand. So I think that is the...
But people who get this do get better, right? I mean, it's not like this is an automatic. If you guys just saw that they had like HIV and all this, because they up there as a comparison issue that has come up in terms of passing things on. So
I don't pretend to be a health official, but what the data is showing is that it's affecting older Americans and those who with weakened immune system. So we just need to be sensitive to those things, and something that we're monitoring and something that we're considering on all of our decisions. Yeah.
The last of my area before I turn to our Chief Safety Officer, Ed Clark, is just transportation. Our bus drivers have gone over and above already in the way that they deliver service to our families and picking them up, driving in the community, but also part of their work guidance is to clean their buses every day. And so they do that on a daily basis, and very similar to what we're doing in our facilities is looking at how do I enhance what we've already done. Supplies is something that we are continuing to look for. We're looking for a large supply order to come in to come in at the end of this week or beginning of next week to help us with that. And then, very similar to our facilities, if we ever had to shut down, the cleaning that happens on a bus as well as in a facility is on a whole nother level. There are some standards and guidelines that we follow. There are different products and chemicals that are used. There are different protections that we use for our staff in those cases. Currently, our facilities team as well as our transportation and food team, we're looking at a scenario of a school closing in the Atlanta area. Fulton County Schools, 95,000 students in that school system, had an employee that got sick in one school building. They shut down for a day. And so one of the things that they are walking through is, what does that mean for someone like Montgomery County Schools if we had one school that was impacted in a way versus if there was a broader community message around just shutting down our school system?
That was one of my questions. If you have an event at one school, do we shut down the whole system? Has Dr. Gales talked any about that, or given, and this may be part of your presentation, you can just say, move on, you're gonna come in, yeah.
So that is a question we've asked, and he said it will depend on the conditions. One of the things that we know about our system is that we are deeply interconnected in our schools, that you might have a child who goes to a elementary school, and if, say there's someone infected there, that child has an older sibling at a middle school, that kid at the middle school rides a bus to a magnet program and then is in the next cluster.
Right.
So we are deeply interconnected in a good way in our county, but it also means that there's greater risk as we think about how things spread.
And I think one of the things that they are doing, and Ed may know more details about this, is really taking the time in the confirmed cases to backwards map everywhere people have been. And they're using those individuals' memories as well as their cell phones, as well as their bank cards. I mean, if you think about it, we all have a footprint of everywhere we've been, even when we can't remember it. And so then you begin, and then you begin to think about, okay, in doing that, what are the potential things there? And then I think Dr. Gales would advise based on that information that he's gathered. I won't belabor it. I'm going to turn to Mr. Ed Clark, our Chief Safety Officer.
Thank you, Mr. Hollis. What I'd like to do today is just give you an overview of what we're doing as a school district in terms of our response and the structure. And as you've heard Doug say, this is a complicated situation. But what we're doing as a school district, we're working under the structure of the incident command system as we respond to this public health crisis. And we're working every day hard with our Montgomery County emergency management team and our public health officials in a collaborative manner. So that's the structure. And you might say, well, what is the incident command system? It's a national response model to deal with a variety of critical emergencies, public health crises, such as what we're facing here, a pandemic outbreak. And it is done at the federal, state, and local level. So we have this sort of unified approach in problem solving, sharing critical information in a timely way. Because as we know, these situations change rapidly, and they change almost hourly in some circumstances here. So again, we're working with the Montgomery County. They've activated their full county emergency response team, what they call is their emergency management group. We are an integral part of that team at the county level. And we work in this unified command system. So we are still working within our structure as our own internal response team, but we're taking the lead and direction of the County Government Emergency Management Group. And Dr. Earl Stoddard was mentioned earlier. Dr. Stoddard is the county-wide incident commander to provide guidance and direction and problem-solving strategies for this county-wide crisis. So we're working collaboratively every day. We are on those daily operational calls with Earl, Dr. Stoddard, Dr. Gales, other county department heads are on there. It's a confidential, high-level call just to make sure we're all in sync and we're sharing critical information, how we can respond significantly together. Because as we know, being a very, very large entity in the county, we have a tremendous responsibility. And our county government partners acknowledge that on a daily basis there. So again, we're taking the lead from Dr. Gales. This is a public health crisis, so we would follow their lead and direction. But it's not as if they are dictating. We're sharing information. We're working collaboratively together, sharing strategies, trying to come up with the best solutions as we evolve through this emergency or crisis there.
Can I ask? I'm sorry. Go ahead.
Our district-wide emergency response team is also structured under the incident command team here. Dr. Zuckerman is our internal incident commander who is leading the team. So we're following that national model to make sure we have all of our relevant entities involved in developing our response to this emergency crisis. So depending on the levels of the crisis, we'll activate things in stages, and then we have to really evolve based on the new information that we're getting on a daily basis.
Thank you. I just, I have a question, and it's not because I support what we're doing here, believe me, but you get a lot of questions, people writing to you, and one of the things that has come up is why aren't we being proactive instead of reactive? And I think they mean in terms of actually closing down. So can you speak to that a little bit?
We are being proactive. In other words, we're developing different contingencies based on evolving information, different levels. So certainly, as we talked about, maybe that's a isolated closure of schools. Maybe it's a regional closure. And then if we get to the point where the county health official says, no, we have to do a system-wide closure, then we are building in different contingencies to respond to those levels of activation there.
And let me chime in here, because I think we're all seeing the same news stories where they're saying a lot of the research says if you close schools early, you can help flatten the curve around a pandemic. And I think we're all aware of that data. But at the same time, what's the impact to our community? Imagine what happens when you send all of our students home. That means parents have to be home too. Right. Those parents are hospital workers. Yep. Those parents are transportation folks. Those parents are key to keeping our community moving during this crisis, and other doctors to keep our community moving. And some parents may be able to have nannies or daycare provided. Others won't, and there will be inequity in for our students around learning and support at home. Some parents will have to lose pay because they can't go to work because they have to be with their child. So we have to really think about these things. While we don't have the final decisions about a closure, it's something that's really important to us to really think about the equity and being proactive and what happens and the unintended consequences. And I'll actually turn it over to Doug because I think they said something very interesting this morning that I think fits the situation.
I think there's two things that they have shared with us in terms of how they do this, and it's really science, follow the cases that we have. And so, as I said, they know exactly why, in many ways, the individuals who have confirmed cases in the county got it. And none of that has really been explained to be larger social gatherings or communal kind of interaction. And so that is what they're following. The other piece, though, is different than, and we can use Snowmageddon as an example. I don't think we knew how long we would be impacted, but at the same time, I think we all know snow will eventually melt. We will come back, right? And that's not to put any fear, because I don't think we should be in a place of fear, but the difference here is no one knows the extent of how long something will go on. And one of the statements that they made on the call this morning is, if we get to a point of closure, I'm not sure what the trigger will be for us to reopen.
Yeah, I was wondering.
Right? And so because of that, we have to think very carefully as to why close in the first place. And so the science and the cases that we have don't say close. Until we get to that point, then we'll be in a different place.
I completely agree, and I would say I already knew the answer. I just wanted the public to hear the answer because I figured they weren't going to care what I said.
Exactly. They're still going to wonder why.
Yeah, they're still going to. So,
and we'll continue to get emails, and we attempt to be responsive where we can to at least help people understand a little bit around our thinking and contingencies we've established.
Okay, Carrie.
Could you just restate though, Derek, what you said about? You said that it has been shown that closing does flatline the spread?
So there's been a couple of studies that have come out in the last, and research in the last couple of days that talked about if you end public gatherings and potentially close schools, it can flatten the pandemic curve of contagion because people aren't near each other for social gatherings. But the trade-off is the unintended consequences. What impact does that have on your community and other community members?
I would just also share, and I think there's people easily try to make connections and comparisons. And so as we see universities starting to close, let's look at that as a comparative, right? Many universities already do a large portion of online kind of interactions with their students. So they're already equipped in their day-to-day to be able to extend that in a remote type of way. Additionally, they live in close quarters. It's not just a lecture hall, but they live in a residential area that includes showers, etc., all those things, right? And then thirdly, is we are seeing some challenges, I think, in many travel groups, airlines, etc., about how we move people. And so the reality is, not knowing what the future may be, universities are trying to figure out how not to have students stuck here on my campus. And so they have a different thing that they are responding to. If the tea leaves are right and in 3 weeks we'll be in a place, I don't want to be in a place where I have all these students I'm responsible for and they have no way to get home.
Right. And their families aren't relying on them being somewhere specifically because they can take care of themselves, hopefully.
We're going to turn now to some of our work with employees. I'll turn to Mr. Talor.
Good morning. Our team in Employee Retiree Service Center is tasked with ensuring the continued operations around employee pay and benefits. At any given point in time, every other Friday, we process anywhere over 25,000 paychecks, and over 70,000 lives are covered by MCPS healthcare insurance plans that include our employees, retirees, and their family members. At this point, we have ensured that key members of our team are able to work remotely and keep supporting the continued operations. Our team has some experience having processed pay and benefits during when system emergencies have happened, like the Snowmageddon that Doug mentioned. We have handled the system-wide closures of all locations or individual location closures for mechanical reasons or like a water main burst or things like that when individual locations have closed. So we do have certain templates to follow in ensuring the payroll and benefit continuity works. At the same time, we are working with, like the instruction side, we are working with the Chief Technology Officer to ensure that certain other members of our team will continue to have remote access as backups to each other should there be an individual who's not able to work for any reason. There is also disaster sites where the data is stored and we can leverage them should there be a need. In addition, our department, our unit does not work in isolation. We are part of the Chief Financial Officer and under the leadership of our acting CFO, Mr. Dan Marella, all of our units are working together to provide like the handoff points from one department to another department and the operations continue. For example, processing payroll or paychecks is not enough on its own unless those electronic deposits are transmitted to the bank, which is handled by the Division of Controllers. They control that electronic transfer. Similarly, sending information over to our healthcare vendors and paying their bills. So when our employees go see doctors and those claims are processed, those payments flow. So we are putting in place those arrangements to ensure that handoff points are continuously and smoothly operating. The budget team is putting together certain accounting mechanics to track any additional expenses that may result as we respond to the situation, so that any reporting that's needed could be done for any purpose from county or state funds that may be available in future. So in a sense, again, working with our incident command team, we are in touch with each other, ensuring that we continue to provide consistent information, because any given month we have about 5,000 phone calls, but right now the number of phone calls and emails have gone up like all the departments. So our team is working to make sure that consistent message goes to our staff and the administrators.
And did you say something about disaster sites? And what is
The
that?
disaster site is a place where the data from our different systems are stored, where their computer systems can be brought up, and we can connect to those systems instead of leveraging our systems. Should there be a need? Should there be some kind of a setup?
Can I just say more about that? The reality is this is not a type of event that we imagine will damage the infrastructure of the buildings that we're currently in. But in the case that you all mentioned, that an emergency happens all of a sudden and they say, for whatever reason, evacuate this building and it'll be 2 weeks before we allow you to go back in that building, we have to have the ability to still operate those functions somewhere else.
Our Department of Technology, they're prepared for all of these situations as well, right?
Yeah, they have set that up for all the different functions throughout the school system.
Hi, good morning. I think it's still morning. So from the perspective, and I think you've heard my colleagues speak about our work together around the continuity of instruction and operations, and what does that mean given the variance of time. So over time, as we've emphasized, things can and will change. And so that means then that we have to be planning along with and for those changes. And so our work in employee engagement and really around the labor management and engagement with our employee associations and unions is, as part of the incident command, an extended part of that is to contemplate the impacts and the implications for the now, right? And the short-term, mid-term, long-term. What does that mean for a community of staff who are 10-month employees, 12-month employees, work a variety of schedules, and as circumstances change, there are going to be impacts associated with leave considerations, with hours of work, conditions of work, compensation, right? And so in our garden variety days of a snowmageddon, and so who doesn't want a good snowstorm right now? We have emergency procedures around how we handle emergency leave and what that means for staff being compensated while they're away from their work sites. What then does that mean for staff when, if for example, we are closed and there's an expectation for some to report? Think about it from a teacher's perspective. While their work continues now to assess options for the continuity of instruction, anything that we do and decisions we take together with our union partners around what then does that mean if we create an expectation, for example, that teacher X needs to report to a given site and we're closed, right? So that becomes a change in that teacher's conditions of work, hours of work, and then we must have in advance of that agreements with our unions, not just with MCEA, our teachers bargaining unit, but other two bargaining units as well, around what the implications are for that shift in that work. We talk about the types of cleaning, for example, that may be occurring in our different work locations. Is that then changing how we prioritize certain work that may lead to work happening outside the regular duty day, and the agreements around those aspects? As you well imagine, there are staff who have questions right now about I've either traveled or I know somebody who knows somebody, and I think I might have been in that place, and should I self-quarantine? We take, as has been, I think, emphasized, and we'll reiterate again, we're taking the direction from the Department of Health and Human Services. The extent to which we request, advise, mandates that someone separate themselves from work, then we do not expect that that staff member would use his or her own leave. There would be in a particular and special leave category. And again, all of those pieces are coordinated and aligned with our union partners so that they are and we are coordinating messages and information, and not just us telling, but they're also helping us learn and understand what questions they're getting, so that our messaging to our staff and community continues to be coordinated and aligned.
So I just want to clarify what you're saying in terms of, so if someone is instructed, whether by a doctor, the Department of Health, or whoever it is, that they should not report to work, that doesn't, they still will continue to get paid. That doesn't count against them in terms of leave, correct?
So that's correct.
And
Now,
like if you're an hourly employee?
Yes, so right. So the particular pieces there and the nuances come with, I may be concerned about going to work because I'm fearful that my school or work site has too many people, and somebody may know somebody who may know somebody who may be sick, or Krishna is in my office and he's sniffling a little bit, and so I'm thinking I don't want to be at work, and so I'm going to say I'm going to self quarantine. Well, that's a decision I'm taking. That means our expectation is you use leave. If we have a concern that, again, based on the protocols established by the county, where we think there's an abundance of due diligence that we need to do and precautions that need to be taken, or that person is traveling from a particular place, again, with the established connections, then we can mandate that person not be at work. In that instance, where it is not their decision, then they would not be expected to use their leave, and yes, they would continue to be compensated. However, if there is an initial decision that says to remain home, and then there is clearance given, but I feel, I think I need to stay out a little longer, then that's on your leave, right? We cannot, that's, again, the guidance there is specific to when it is not the employee's decision.
So if we shut down the schools, or, not because we decided to, but if DHHS decides, things like, I'm just thinking of our bus drivers as an example. So they work hourly. Do we just go based on what their average hourly or weekly paycheck amounts to continue to, because I'm assuming even if the principals, for example, who are 12-month employees are still attending work, they don't have any children to deliver, so they have no.
Yeah, so we have, again, we have, and I'll turn it over to Krishna here in a second, we have established processes around what that looks like, so it's not a blank palette because in a circumstance like that, there is some emergency declaration that has put us in that circumstance where we're closing, and then now we have a time reporting piece that we need to attend to. So.
In an emergency closure situation, the current guidance is individuals get paid for the hours they are routinely scheduled to work. So it's not which could be an average paycheck, but it is based on their scheduled hours.
Could I just ask, I want to get through everything that you brought today, so if we're asking too many questions and we're not moving along fast enough, could you let me know? Because I want to get through the whole presentation.
Yeah. I only have another 30 minutes to go.
I know you. I know you.
I was going to say.
Just.
I'm not talking about you. I'm just talking about.
just kidding.
We can hold our questions.
Yeah, I know. I was trying to cover for Doug, but.
We can hold our questions until the end, I think, unless it's really pressing on you.
So I think that the important messages that we just want to emphasize is, as we plan for these contingencies, we're working in collaboration with our unions and associations. You heard Dr. Navarro and Ms. Alexander speak to the work just done yesterday, working across with teachers, support professionals, administrators, looking at those options. So as we define and devise those options, it requires us then to think about the impacts and implications for work, for hours, things around cleaning, and so we plan those. We work together with our union partners around the agreements, around those impacts that we need to define. I think the overall message still continues to be, if you're not well, don't come to work, right? I mean, and I think that's whether it's coronavirus or not, we want people to be exercising those same precautions. We want the work that we're doing with our partners to be clear. We want that to be grounded in the guidance from the public health officials, who are in fact the incident commanders in charge of that decision making. And through our different collaborative processes, whether we work one-on-one with respective unions or together. It's important to know that as part of the incident command system, our union partners are part of that extended team, and the efforts there are to ensure that we're lockstep in alignment, certainly honoring our contractual obligations, but more importantly, being able to communicate to our staff, their bargaining unit members, with a singular voice and message around how we ensure the continuity of operations and instruction.
Can I just jump in with one more quick question? It's not a staff, it's more about the students. We brought it up at the board meeting yesterday, but just for clarification, what's happening with our attendance policy for the perfect attendance? You know, a lot of families take that very, very seriously, and I'm very appreciative that they do. So I wouldn't want anyone sending their kids to school because they don't want to miss a day of school.
That's a great question. So we have done an extensive amount of research, and we are getting ready to put out additional communication. I know that Dr. Wilson has communicated with principals around the attendance policy, and we will be putting out communication for the community. Of course, if a student is sick and unable to come to school, it is an excused absence. And so we want to make the distinction between that, and we understand that there's anxiety, and we have families that are going to make that decision to say, you know, I don't feel comfortable sending my child to school at this point. And so we're talking through all of those pieces, what that will look like, but just wanting to reiterate that certainly we don't want students to come to school if they're sick and ill and not feeling well.
But just to clarify, through our policy, if you are not at school because of an excused absence, that doesn't count against perfect attendance?
So I actually would need to take a look at that. I think we have the ability to take a look at what happens with the whole perfect attendance piece, is where I'm tripped up with it right now. So we need to go back and take a look. I know we've done some research about SSL hours and what can happen. Perfect attendance we haven't quite looked into, so that's something I would love to get back to the board on.
Okay.
It was actually my turn again, so.
I
know. So we as we get ready to move into our final piece of the presentation, I think one of the things that we're hoping, we really appreciate this opportunity because we're hoping that the public gets to see the nuance and the complexities that go into making a decision about, you know, what will happen in the event of a school closure. And so the communication, this is another forum for us to be able to communicate. We've utilized a variety of mediums at our disposal to be able to communicate to our community members. And so without giving them any more accolades, I think the communication team has just done a tremendous job. And so they'll be rounding us out with talking about what that full-scale communication work entails.
Thank you, Rochelle, and good morning again. As you can imagine, communications is interwoven in every area of our operations and our work that we've discussed so far this morning. And so recognizing that communications, ongoing communications with our families, our students, and our staff is absolutely critical. And what we're working to do is provide timely and accurate, I want to stress, accurate information. I know there's a desire that, you know, MCPS every day just puts out messages. We have to balance the need of informing the community and providing them with accurate information and resources with adding to this 24-hour news cycle that is just spurring this anxiety and panic in our community. And so what that looks like for us, as everyone here has talked about this morning, is that close collaboration with the Department of Health and Human Services and other county agencies to determine what and when we are sharing, but as Rochelle indicated, utilizing all of the methods and tools that are available to us. We have a team that meets daily. We're either meeting face-to-face, we're talking on the phone, we're texting each other, including the weekends, to think through strategy, to think through the topics that are bubbling up in the community, the questions that we're receiving via email. I think, as you said this earlier, Ms. Wolf, that you don't think people actually care what you may have to say about the particular topic. However, it is important because you are a representative of the board and of the, as all of us are as representatives of the school system. And so there's a large task before us, understanding that the community may receive our information, but they still feel a certain way. For example, that schools need to be closed today. No matter how many times we've said this is a decision that is not in the hands of MCPS, as you were saying that, I think 3 or 5 more emails came in saying, close schools now. And so our response continues to be, this is a collaborative effort. We're sharing information in a number of ways. I want to give you a few examples, including these flyers that I believe you have in front of you. These have been sent to all schools. We have them available in multiple languages. And when we met with principals last Friday, we had 3 meetings to meet with principals across all grade levels. We shared that, you know, depending on the needs of your community, if you want to hand these out to each individual parent, just let us know. We'll get our print shop right on it. We'll get them out to you on the pony. We recognize that not everyone is accessing the information that we're sending via email. So what are some of these critical pieces that we can send in hard copy format, utilizing the methods that we have now? We're utilizing our social media platforms, our website, to address the false information that Mr. Turner spoke to earlier. We want to encourage members of our community, as we shared in our message on Monday, to look to reliable sources of information. Visit the MCPS website, our main website. As soon as you MontgomerySchoolsMD.org, the first thing that you see as our blurb is about the coronavirus. We have a whole web page that includes resources, information, all of our community messages in the 6 languages that we translate, video clips of the press briefings that we've had with Dr. Smith, Dr. McKnight, and Dr. Gales, as well as the county press briefings. We just want to encourage them to visit these official sources of information, because that's where you're going to get the most up-to-date information. To date, we have sent 5 community messages, with the 6th one scheduled for today, including staff members. And again, it's going to be translated in all of the languages that we normally translate our information into. But recognizing that this is a situation that goes well beyond the school system, we are providing all of our information and messages and resources to our partners for them to blast out on their listservs, to put up on their websites, on social media. Dr. Gales, on one of the morning calls, the county calls, had shared that they have team members, staff members going into community clinics, places like the Gilchrist Center, handing out these flyers, handing out resources. We're going to be equipping our PCCs, who are our frontline staff, for many of these hard-to-reach communities with talking points, with flyers, with resources that they can share with the families that they're engaging with and interacting with every day. Yes.
I didn't mean to, but are we providing any kind of oh, I'm sorry.
That's okay, go ahead.
You always have your light on. So,
No, I turned it off.
are we providing like cleaning stuff or hand sanitizer type things to some of our families if we feel that they need access to it, or wipes, or?
We haven't done that yet.
Okay.
I'm not saying it sounds like a really good idea. Right now, we're trying to make sure that we're caring for all our families as they're in our schools. But if there's an opportunity to do that, that is something that we will explore.
I just meant as PCCs and whomever are going out into the community. It'd be nice if we could supply them with things in case they want to.
We can note that down.
So when you say you're sharing information with your community partners, what does that look like? Because A lot of people don't have internet. So I heard you say about 10 different sources, but they were all sort of internet based. So what does that look like?
So,
I mean, I heard the Gilchrist Center.
Yes.
But I'd have to be able to read this, number one. I know I saw it in Spanish and I saw it in English.
Yeah. So, absolutely. Part of that includes the flyers that have been, sent to districts and state agencies from the CDC. Again, we want to point people to reliable sources of information, so things that have been vetted. But it also looks like call scripts being provided to 311 staffers who are speaking with members of the community. So maybe people in the community who don't have access to the computer, have access to phones, and they're able to call the Montgomery County 311, but also our Ask MCPS staff who speak both English and Spanish and can engage with our communities that way. And when Dr. Gales was talking about their staffers, they were talking about just the verbal sharing of information, making sure that patients who are visiting these clinics, families that are visiting the Gilchrist Center, kind of understand what is going on, county, the state, national, global pandemic. So I think we're just trying to utilize all of the resources that are available to us now as quickly as possible because the information changes every day.
What about grocery stores? Do you hang these up in grocery stores and churches and things like that?
Something for us to take down. No, we haven't, deployed a team to go because I think everyone here, we're answering phone calls and answering emails. So, but that is, a great suggestion, and thinking about our libraries, but they are our county partners as well. So they are also printing information, putting that up in their shared spaces. But things like grocery stores, I don't think we've been able to visit yet. Did you have another question? Can I? Okay.
I just do. Maybe you're going to say this, but would it be possible for us, as we're sending out the links to the communication, to text a link so that if someone doesn't have email or internet access, they can just click the link on their phones and get the message as well?
So I was going to get to that a little later on, talking about our Alert Montgomery system, because that is the system we have in place right now that allows us to text families who have opted into that service. Again, the balance is not wanting to add to the level of panic and anxiety, but recognizing this is an emergency situation. And we have shared with our families earlier this year that we were going to be utilizing Alert Montgomery to share information well beyond weather-related closings. So we anticipate that we will have to quickly start utilizing that service, but we don't want to bombard our families as well because they're getting it 24 hours of the day and everyone is just so concerned. But it's absolutely something that we've talked about and have at our disposal should we determine that, we want to quickly turn on that service as well as part of our response efforts.
It will be a nice testing ground for because we, our resolution said that it would start by the end of the school year. So this is a perfect way of testing. Let's see if people get our information or not.
Absolutely. Work that has been ongoing for us as an office is reaching out to families to understand what are the ways in which they like to receive information. And we've had a communication survey now 3 times, I believe, twice. And overwhelmingly, the majority of the respondents have shared they like to hear directly from the schools. A good example of this is when Dr. McKnight went to the County Council Tuesday briefing. This was last week, and a council member, I won't say his name, said, "Oh, well, I haven't seen any messages from MCPS about this." At that point, we had probably sent 3 community messages, had the blurb up, had social media. But what he said next was really interesting. He said, "I wait by the phone Sunday night for my principal's phone call." And that was, it supports everything that we found in our survey because they know we exist as a district, but the school's really the hub. School is home for them, right? And so what we've encouraged our principals to do when we met with them last Friday was everything we're pushing out as a district, please, please, please push out to your families on your Sunday weekly newsletter, your Sunday calls. And they were like, yes, actually, that is something that we'll do because we know that families are tuned into their principals as the leader. So that's something that we're adding as well. We're working with Krishna and his team around messaging for staff, answering their questions about leave, answering their questions about if I decide to go home today, what happens? And so in addition to our community message today, we'll also have, I think, a third or fourth staff message that will be going out this afternoon. Our goal is to be both proactive in terms of timely communications, but also responsive to the needs of our community, because the questions are coming fast and furious. You know, we send out one message that addresses 10 of those questions. By the time we've hit send, there are like 20 more questions that have come in. And so what we're doing is quickly folding that into whatever message needs to go out next, making sure that we're answering their questions to the best of our ability, but looking to our partners. The last message that we sent out was a joint message from Dr. Smith and Dr. Crowell, who's the director of the Department of Health and Human Services. And they promised as well to put that information up on their website and all of the blasts that they would be doing. So this is a collaborative effort. This is something that, you know, we have to be nimble and agile as we understand what are the true needs, other than asking us to close schools today, which we cannot do and will continue to stress. What can we put out there to help, you know, calm the fears, to help parents understand that we do have a team that is ready and working on all of these topics that they are concerned about, while doing it in multiple languages, while providing it to centers and libraries and other county agencies that are interfacing with our families as well. And then I just specifically wanted to call out examples of using our traditional media partners in this effort. I see we have our reporter here from Bethesda Magazine, but in addition to working with them, our news stations, we have been very active with them, providing them the community messages, sending them to our website, because for some reason they're not tuning into our website, but they are watching Fox 5, right? So we need to make sure the information that Fox is putting out there is accurate. The information that NBC is putting out there is accurate. And not only are we doing that with those traditional sources, our Spanish communication specialist has been going out and conducting interviews with Telemundo, with Univision, with Radio America. They've done Spanish pieces in for Montgomery Community Media. So we're thinking through all of those pieces and how it has to be interwoven in the work that's ongoing as we respond to this emergency situation.
I was just going to suggest that when you're talking to the media outlets and whatever, you do emphasize to them that it's important if they're reporting something, if their kid goes to a private school or out of the county area, that they clarify that when they put that information out there.
Absolutely. So yeah, I'll take any questions.
I'm not sure that I heard how we're providing access for all students. How we're going to be able to do that, particularly if they have, was that the packet thing in paper packet? Is that, okay.
Yes, the hardcover.
If I may. One thing that we've gotten emails about is wiping down Chromebooks. Is that happening?
So Octo has just some specific guidelines that they have had, that they've shared with classrooms around how to clean and care for the Chromebooks. They are sending that information out, exactly those exact things again. I don't know the details of those, but they have re-communicated that again to the schools.
Octo, you said?
Yeah, Chief Technology Officer.
Okay, thank you.
And just one of the things that we're encouraging, both in addition to scrubbing the handles and doing surfaces, because the complexity is, as soon as you clean off a surface, a kid touches it again, and then you're starting back over.
Yeah.
So the idea that we can make the surfaces always germ-free is a struggle. But what we do encourage is washing your hands. Those things can be proactive. If you're washing your hands, if you're not touching your face, those things that kids can do actually help us mitigate the impact of a handle that has to be wiped every 10 minutes.
Are we able to get reimbursed for some of these additional expenses from FEMA or the federal government?
So I think for those who watch it closely, part of the governor saying that we are in a state of emergency and putting that proclamation really is to move funding, rainy day fund, and allow there to be the opportunity to do those things. That said, I think other areas that have experienced crises in the past know that money trickles slow. So to be honest, we are spending and doing all we can with what we have, and then we are very hopeful about those funds becoming available to us and getting here in a timely fashion.
So I think an important aspect of that is to what Mr. Tolo referenced before is within the Chief Financial Officer's area, that work has begun to create the accounting for that, because whatever we may want to seek in terms of reimbursement, we need to have adequate and effective ways to track that, so that work has begun.
Along the lines of the communication, thank you for that wonderful update, and I'm glad that the validation has come through from our surveys about parents preferring to get communication from their schools. I believe that 100%. And, you know, through emails, through texts, through just hitting all the different options. I don't know, Derek's not going to like me saying this, but I'm a strong believer of paper in the backpack, especially for the lower elementary grades, because parents still check that. They have older siblings that they can, and I think people in the health profession are experts in how to communicate important messages with simple language and images that are easy to understand. So these are great flyers that I think should be disseminated into the community. From a mental health perspective, how do we talk to our kids about this so that they're not freaking out on top of everything else that they freaked out about?
No, thank you. We actually have been able to put out, I think, several pieces onto the webpage that we have on coronavirus for explicitly that. And some organizations like the National Association of School Psychologists have some tremendous resources, and we've been pushing that out to our families.
What would you say is the elevator speech?
Elevator speech, you put me on the spot there. But I would say, you be calm yourself.
Okay.
Don't incite fear. Listen to the questions that they have and the concerns that they have, and work to just reassure them. That's like the biggest thing that's come out through all of the messaging.
Okay.
Yeah.
And finally, I know that you mentioned Atlanta, one of the county schools there, but King County is a couple of weeks ahead of this because they got it early, and then even parents have emailed us about other countries in Japan, Korea, that have had this more widespread. Is the team here learning from systems that have experienced this earlier and are weeks and months ahead of us?
Yes, our goal is not to reinvent the wheel and to really follow guidance. I mean, we've been spending a lot of time on Seattle's page, looking at other counties as they're developing and they're coming up with new ideas. I think we're all facing the same crisis, and the resources are available, and we can tweak an idea that better fits our community, but we're all in the same battle, and we're all trying to come to the same conclusion.
And we participate every Thursday with the Maryland Center for School Safety. There is a statewide school safety conference call amongst all of the safety colleagues throughout the state. So we're exchanging information, trying to share best practices. So we have our finger on the pulse of what's occurring within the state of Maryland.
I also just want to say, I think Mr. Clark is underselling it a little bit, because I will also say, like, he put out a survey to that community last week asking about some of the key areas that we're making decisions, and we have grabbed consolidated information about other counties in Maryland regarding closure for field trips, or limitations on field trips, or limitation on staff travel, and things of that nature. And that was just the action of being a part of that body, and then Mr. Clark putting that out there and getting those responses.
I was gonna say my next question was about extracurricular activities and field trips. Brenda, Ms.
You
Wolf
have
was
some
just saying.
information on that you want to share?
Who gets pressed button first? So today we're going to be making two announcements. One about new restrictions to staff travel and new restrictions on field trips. As we're watching the other counties around us and other jurisdictions, the concerns about mass gatherings have given us additional information and additional pause. So we're going to be announcing further tightening and restrictions for both employees and students.
Yeah, I know, as I mentioned yesterday, I heard from a company that had field trips scheduled for kids to come and tour, and they said, yeah, no, we're gonna cancel that too. So I think the places that our kids are going, they don't necessarily want everybody showing up there.
And just to add to what Mr. Turner said, not just field trips, also athletic events. So
Right.
we'll push that information out to our community and point them to our site as well for those details.
I only have one more question. It's just in reference to our planning ahead with the packets that might go home and how we're going to give those to kids. Are we looking at all at providing, I know some of our schools have the computer program, or whatever you want to call it. It's where the kids get to take the computers home. Are we looking at any of that for our kids and families that need that, or the little hot buttons for internet access, that kind of thing?
So we are. Octo is working to think about how do we get Chromebooks and MiFis, which would be those hotspots, to students who most need them, and thinking about what makes sense in terms of prioritizing, and is it necessary in the short term or more of a long-term approach. So that work is being done as well.
And I know I kind of asked about this before, but if we were to, if let's just say hypothetically, tomorrow night, HHS says, you're not opening tomorrow. How are we planning on, or do we have a plan in place in terms of people going to the communities to distribute this stuff? Or are we going to set up a place where people can come during different hours of the day to pick things up, or?
So we're still finalizing what that looks like. Very possibly it could be community someplace central. They could be left. Our other hope is to get them into schools, not distributed to students, but into schools by the end of the week, with the hope that if schools heard same day, they could then quickly get them out. So that doesn't help the overnight change, but it could be this is your last day kind of change.
I would just add that one of the things on the county call that we owe them back today is really, they asked, particularly with the extension of food services, if we were closed, and I think this is very similar. They're asking what other county agencies do they need to bring to bear to help us be able to distribute those things. And so I think there are a number of other ways. If schools are closed, but there are other county workers that are deemed essential, how are we able to then be able to provide using other agencies throughout the county and possibly even locations?
Right.
Do you, would you be providing, let's say, lunch or whatever for anybody that comes up, or do you have, I mean, how do you identify where the need is?
In the past, I think we have identified, I think we have 10 sites, if I remember correctly.
In the summer, I know you do.
Those have been based on specific needs and saying these are communities in which we feel like we need to make sure we provide. In terms of those who come, regardless if you're an individual who is in a particular need or circumstance or not, no one's being turned away.
Okay. Ms. Silvestri?
Yeah, just going back to the academic piece, which is of course of utmost importance. Just so that I'm understanding, the short-term plan is to provide either online or packets that would be review materials for students.
We're saying review, practice, and extension, and by that I mean when we think about reading, right, and our elementary students, they can continue to read new materials, they can answer questions, those kinds of things. Math, we have a lot of fluency, as Dr. Navarro mentioned, practicing key areas that they've studied. And it may extend their learning. When we think about some of the secondary projects, it takes, and I say projects, but assignments, it takes a concept. They studied genetics a couple of weeks ago in 7th grade science, so they could do some work related to that piece.
And somehow we will say that this is expected, that you will do this work, not just I'm off. So one thing.
I'm off playing video games.
We are always saying that we expect students to do work at home. The question around this is for the short term. We want to make sure that students take this and first and foremost have access. It is aligned to the work that they have been doing, and so we expect them to do that work. Now, what percentage of this is graded and so forth, we haven't given those details out, But we publicly want to tell every single one of our students and our families that work is coming home to you for the short term, and we expect students to be engaged every day to do that, and we will make sure that if you don't are unable to access it, we will have ways in which we give you that that work.
Okay. And I understand that the long term is
still
a plan in development and a lot more challenging to tackle, especially with graduation coming up or high test IB exams or IP exams and so forth. Thank you.
So,
Well, I know I asked about it before, but I just want to clarify. What about graduation? If there are kids who have graduation requirements, I'm just concerned that if we end up in a situation where they're expected to do the work on their own at home, and how are we?
So we're going to see how the situations progress. And then should we request any waivers from the state, or should we be looking at any assessments? Like we said before, we've been in contact with College Board. We're not the only district that is calling College Board and universities around that process. We're not there yet, but we have began those contacts so that we can pinpoint, should we get to that point, what's our course of action for requesting some things. Locally, we looked at our policies and COMAR to see what the local superintendent can do locally for requirements, such as things Rochelle mentioned, SSL hours and all those local graduation requirements. And then state requirements, and then other requirements for other agencies such as colleges. So we're triaging that process. We have charts that kind of enumerate what our actions would be should we start to pull them together. We're not quite at that point yet. But our focus obviously is going to ensure that out of all of our students, the seniors, we're closely monitoring the seniors at a time of, let's say, extended closures.
Right, okay, and
Yeah.
SATs and all that good stuff, I thought, that
Yeah, through the
comes up in the
College
spring,
Board
right,
and-
okay.
yeah.
And what about our career pathways certifications? Are you working with?
Same thing. So actually, the OSIP team has looked at, there's kids that are out doing internships, and if there's a facility for some reason, we have a huge healthcare pathway. And if there's a facility or the hospitals are right now sort of saying, not right now, we gotta attend to some emergencies, the team has already been working on options that students can do that will count towards the hours that they need for those required pathways, especially in that area. The other ones we haven't seen yet any kind of disruption, but especially in that area.
And that just sparked my last question. I promise this is my last one. But if the schools do close, our wellness centers, and they're run by the county, any word on whether or not they will remain open, as particularly?
We haven't heard anything different right now from Dr. Gales, but I think he would probably, in those county calls that we are all in, would let us know if there would be any impact to those linkages to learning, and wellness centers are all run through the health department.
Right.
Well,
One more question.
oh, it's okay, go ahead.
Is there any, I'm thinking about vulnerable students. Are there any vulnerable populations that we should be thinking about that would have maybe more severe implications if they had to go home and didn't have the usual supports that are in place at schools?
So we have actually, OSSI has done a tremendous job in collaboration with the Office of Special Education in particular in pushing out information specifically to our vulnerable population. So we know that because if a student is experiencing or has a documented underlying health issue, there's a greater impact. And so not only have we communicated that, but also have started putting in place what does the work look like and the support, the continuation of learning for those particular students look like. I think so we've gotten quite a bit ahead of that in particular.
And in terms of the daily if I have a concern, I should contact my principal. If maybe I have a vulnerable family member in the house that is immunodeficient, and so who do I call to clear whether my child should be going to school as the situation progresses? Maybe not today, but in the future.
So there are a couple different layers there. If you just have a general concern, I want to voice your frustration. Don't
call your principal.
Please don't call your principal because they are working through a lot every single day. Call our Ask MCPS line. We've provided that in our community messages. We've provided it on the website. Health-specific questions about, I'm concerned I was exposed, someone was exposed, I'm in a general area where someone possibly could have been exposed. We've provided 2 key numbers, a state, I think it's their information bureau, health information bureau. We've provided their call center information, as well as DHHS. They've given us a call center line to share with our families, and we've included that information. Parents who have specific questions about, I want to pull my child out now because they have underlying medical issues and what does makeup work look like, absolutely have those conversations with your principals. They have been equipped and armed with the right information on how to make those special arrangements, and they stand ready to do that. But please, if you have any general questions, you can call our office, call the Office of Communications, call Ask MCPS, and we will be happy to help you.
Thank you.
Well, I want to thank you all for an excellent presentation. I know we took a lot out of your day and you need to get back to your phone calls, but I will tell you, one thing that I saw on TV this morning that I thought was a great idea. It was an elementary school teacher, and she'd been talking about the coronavirus to her students and washing hands. So now what she does is she stamps their hands when they come in the morning. And she said if the stamp is still there at the end of the day, she knows they have not been washing their hands. I thought that was terrific.
Yeah.
So thank you. I really actually learned a lot today. I mean, I thought I knew everything that we were going to say. So thank you.
Yep. Thank you very much.